So what is a virtual encounter? There's an easy answer and then a bit longer conversation. The easy answer is this. Reset virtual encounters are telehealth encounters in which a patient engages with the MTF with a chief complaint and a desire for an appointment. Once determining that the need isn't urgent, the team or appointment line asks if they would like sooner care via a virtual visit. The technician then does everything like a usual check-in. You know, the copy forward, the med rec, the HPI. The only exception is not taking vital signs. There's still a report given to the provider, who then takes over the note in the encounter and establishes the assessment and plan. In the legacy system, virtual encounters were added to the template and have largely been used to manage administrative tasks that don't really meet true patient appointment demand. Although this was a step in the right direction to capture provider workload, it didn't actually improve access or reduce patient demand. In fact, by decrementing the templates for adding these virtuals, one could argue that their addition in the AFMS actually reduced patient access. Reset virtual encounters are not PHAs. They're not med refills or normal lab results. They're not TCONs. Virtual encounters are a powerful pathway to care, and we've made the process really efficient with Reset, and we don't want anyone to miss out on that. For so many patient complaints, they provide a way to accomplish more accessible, flexible, sooner, and in many cases, even better care. Many healthcare systems have been doing virtual medicine for years. In fact, Kaiser Permanente is now doing 52% of their visits virtually. They recognize that we should focus on how to spend our budget to serve patients and keep them well, rather than increasing revenue-generating visits and procedures. In a study conducted late last year by the University of Missouri School of Medicine, roughly 80% of providers and patients said they were satisfied by the care delivered and received through a virtual visit. And in a 2014 study by the Richard Rodebush VA Medical Center in Indianapolis, they found that over a 2-year span, veterans using the center's telemedicine platform saved the hospital more than $330,000 in reimbursements and cut out more than 770,000 travel miles by veterans. In addition, the overall satisfaction rate among the veterans stood at 96%. Other research agrees that telehealth consults are significantly less expensive to conduct, saving at least half the cost of in-person care for common acute conditions. The Alliance for Connected Care says that remote consults are inexpensive, yet 83% effective in resolving the chief complaint. When a patient uses telehealth instead of letting his or her symptoms drag on unresolved, it can also produce measurable downstream savings. And our wing commander definitely likes that we are doing virtual care and keeping people on the job instead of the 2 hours that it takes to come in for a 15-minute visit. Their care is taken care of over the phone from their office, and so far at Ramstein, we have saved the wing 1,464 man-hours.
Before we make the call, let's stop and remember that our goal is to take awesome care of our patients, and when possible, meet their needs sooner and open up their future appointment for other patients so that we can get on the right side of the demand wave. With virtuals, we've found that it's often better care, less rushed than crammed into a 15-minute slot, more conversational, less awkward than trying to pour through their chart while they watch you and try to make casual conversation. It's more than just being more convenient, and you'll have to try it out for yourself to see what we mean. At Ramstein, we've caught several things much sooner due to virtual care and scrubbing. We've had a suicidal patient caught same day after booking an appointment for next week for poor sleep. We've had care coordinated for a patient seen on the economy who had a renal infarct and emergent nephrectomy, who wound up on the schedule for next week for his follow-up and was in need of anticoagulation and a hematology consult.
So you've learned why we do virtuals. Now we'll show you how we do them. Hop on over to the next tutorial.